I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about the risks and benefits of ketamine therapy as a treatment for marijuana addiction. So let's talk and learn about this subject with our guest. Dr. Aaron Boyd is a board-certified emergency medicine physician and the owner of Lumina Mind Health, a clinic that specializes in treatment-resistant mood disorders and substance abuse. Dr. Boyd, welcome to the forum. Tell us more about yourself.
Well, thank you so much, Heidi, for having me. I'm really excited to talk about this topic. I have been practicing emergency medicine for over a decade now, and I have treated a wide variety of emergency conditions, which include psychiatric conditions. And I have also been well-versed in using ketamine during my entire career. And so I came across some very interesting research over the last several years that combined kind of this new types of therapy using ketamine for mood disorders. And I thought it would be a great way for me to combine my experience and open a clinic to help people in a little bit of a different way.
Good. I'm looking forward to learning more about that and sharing that information with our viewers and listeners. And to everyone joining us on this live program, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have Dr. Boyd answer them. We also want you to tell us what you think about this forum by completing the survey posted in the comments on YouTube and Facebook after the live program. Your name will be entered into a drawing on September 5th, 2024 to win a $100 gift card provided by one of Mary's partners. Now, let's start this conversation on cannabis. So Dr. Boyd, let's just go ahead and tell everyone, what is ketamine?
Well, ketamine was actually first developed in the 60s, and it's an FDA-approved drug for anesthesia. So it's used in the operating room for anesthesia. We use it in the emergency department for sedation purposes. It can be used for pain purposes. So it was developed for really a completely different reason than for mood disorders. But interesting research in the early 90s kind of found that ketamine might have some alternative uses in treating treatment-resistant mood disorders like depression, anxiety, PTSD. And so there's kind of this new burgeoning of research that developed 20, 30 years ago. And now we have more evidence that shows that it can treat people in a different way than just in the OR or in the emergency department.
Okay, so what is ketamine therapy and how long has it been around?
In this context, ketamine therapy is if somebody is diagnosed with a treatment-resistant mood disorder, like for example, we'll use depression. So if somebody has tried multiple types of medications or types of therapy for their depression, let's say, and they're not improving, they're not getting better, which is unfortunately quite a bit of people, people can come and receive IV ketamine therapy. And evidence shows that if done in the correct way and under the guidance of a physician that knows about this type of treatment, we can really see an improvement in their mood disorders. And so they would come to my clinic, for example, and receive several sessions of IV ketamine to treat their mood disorder. So I think that's the general context of what we're saying ketamine therapy is.
Okay. And then can you kind of walk us through what that process looks like? You know, how is it given to the patients? I think it's administered through like infusions. Is that correct? Yes. Tell us about that process.
Okay. Well, how we do here at Lumina Mind is first and foremost, we want to make sure we select the right patient. So we really pride ourselves in making sure that the patient really does meet a criteria for a treatment-resistant mood disorder, or of course a substance use disorder as well. So when they come to my clinic, they see me and also a board-certified psychiatric nurse practitioner who works alongside me, and we evaluate the patient. And if they meet these certain criteria, that they try different modalities for their mood disorder or addiction, and we're not seeing the improvement that they would like, we deem them appropriate candidate to receive IV ketamine therapy. And so what that means is we only provide IV therapy. There are different other ways you can use ketamine. It can be an IM shot in your muscle. It can be used orally, but here we just do IV. We do a minimum of separate IV therapies over a 2 to 3 week period. And we monitor their mood, we monitor maybe their cravings or types of symptoms, for whatever reason they're coming in for. And so that's kind of the general context of when patients are kind of coming into the clinic for their therapy.
Yeah. So how do you, so for someone who may have be dealing with cannabis use disorder or marijuana addiction, how does that treatment apply to them?
So first I can talk a little bit about ketamine. So how it works in the brain, and what's really interesting about it is it works on a receptor called the NMDA receptor, and it antagonizes this receptor. And what this means is it causes this pretty incredible downstream effect that increases a neurotransmitter called glutamate. And when this neurotransmitter is in the brain, it increases communication in the brain. It increases the ability to kind of almost create nerve growth. And what that can do is it can change somebody's way they think about certain things, maybe the reasons why they may be addicted. So it kind of opens their mind to a different way of thinking, which I think is very fascinating. So if someone's coming in here to receive treatment for cannabis use disorder or maybe another type of addiction, we can use typical modalities like motivational type enhancement therapies or cognitive behavioral therapies, but which do work. But in addition to using something like ketamine that might increase the brain to be more open to change, well, if that's what they're coming in for and they're addicted, we want that. We want somebody's thought process to maybe change so they're not suffering from the addiction. Yeah. And the thought process that go along with the addiction. So the addition of ketamine therapy can be very helpful for cannabis use disorder and other substance use disorders as well.
That's really fascinating. So if someone when they're getting this infusion, you talked about, the impact on the brain, what do they feel during and then after the infusion?
During the infusion, most people feel a sense of calm. They might have a bit of a euphoric feeling, but also almost a dissociative feeling. And the ketamine is also known as a dissociative anesthetic, and which means it's kind of an out-of-body experience. So people may feel that they're floating. Some people describe it as they might see kind of orbit space, or they're in the sky, or some people can kind of see different things or see shapes. I mean, it can be everybody's very different, but generally people find it to be a calming, peaceful, heightened experience. And
then when they're done with the infusion, what do you all do before you send them home?
So at our clinic, so the infusion itself actually lasts 40 minutes, and then we allow about 20 minutes for the drug to sort of wear off. So that's an hour. But then we also have another hour that's always blocked off where I have my nurse practitioner who's board certified in psychiatry in the room with every patient. So after that hour, we spend time either discussing maybe what the experience was, or if they're coming in for depression or their substance abuse, maybe that's a very vulnerable time in somebody's brain that they can talk through things or whatever their experience was, or kind of whatever came about the infusion. So we also spend that hour providing that type of care as well. And then as long as they can, tolerate maybe some fluids, they can get up and walk, then we deem them appropriate to be discharged. And then we make sure a patient has an appropriate, safe ride with a trusted family or friend to go home with.
Okay. And then I'm sure everyone who's listening is wondering, well, what are the side effects of the infusion?
Of course. Yeah. So some of the side effects, in terms of maybe some negative side effects, some people do get nauseated or feel like they might throw up, unfortunately. And so we can provide medication for that as needed. Dizziness is a common one. But the drug wears off fairly quickly. After a couple hours, it's typically out of your system, and any kind of adverse side effects are typically gone fairly quickly.
So if someone is listening to this and they're just, I'm curious to know if this would work for me. Mm-hmm. Are there previous conditions that would make someone a poor candidate for ketamine therapy?
There are. So particularly, we're not treating currently patients who have a history of psychosis or mania, schizophrenia. These are mental illnesses that right now ketamine we're not treating. So if you have a history of that, you're unlikely to be a candidate. If you have very uncontrolled high blood pressure, we would prefer that you might go to your primary care physician and get that managed a little bit more appropriately before receiving ketamine therapy. Any recent heart attacks or strokes, we probably would wait some time or maybe get clearance from a cardiologist, for example, before you receive treatment. So there are, and we don't treat pregnant patients or people under the age of 18. So those are some exclusion criteria.
Yeah, you mentioned the primary care physician. So what is the relationship between what you're doing and other therapists who do what you do with someone who is using ketamine therapy? And then how do you bring in that primary care physician? How does that relationship work?
Well, many primary care physicians are the sole treatment providers for a lot of times for patients with depression, anxiety, or even sometimes are substance uses. And so that can be good and bad. So as a primary care physician, they're busy, they have a lot going on. So if they have a patient that they're just not receiving the improvements like they want with whatever medications they've tried, they can refer to us and we'd be happy to see them. And I really enjoy sort of that collaborative relationship with other primary care physicians, that they can just send patients to us, call me, refer patients to me, and we can treat patients that way.
That's so interesting. So how common is ketamine therapy in Florida? I mean, is it growing in popularity now?
Yeah, it is growing. I try to do a bit of a search on how many clinics there are, and I found there's quite a few clinics. Just in Tallahassee alone, I was able to find 5 that provide IV ketamine therapy for various reasons. That includes mine. So I think that's quite a few for our population. So it is growing, and I think it's expected to grow over the next several years.
So with more and more people looking into it, does insurance cover ketamine therapy?
Right now, as far as I know, at least in Florida, it is not covered by insurance, but people can use their health savings account, and we can provide super bills for patients that they can submit to their insurance carrier to see if they can get reimbursement. And some people do have quite a bit of luck with that.
Yeah. Well, as you can imagine, we're starting to get questions from people asking about people associate ketamine use with celebrities like Matthew Perry, who died from overuse of the drug. So let's pull up this question from that Spencer guy who said, is ketamine in the class of opioids? And what are your thoughts on Matthew Perry, who was on ketamine treatment and he passed away?
Sure. So ketamine is a scheduled drug. It's a class 3 scheduled drug that is monitored by the DEA. So in the terms of opiates, yes, that's also a controlled substance as well. So in order to be able to provide ketamine, you have to have a DEA license, and your clinic has to have a DEA license affiliated with the address. So in terms of Matthew Perry, he, from what I've read, he was receiving IV ketamine therapy for his addiction or mental health conditions. In terms of where it transitioned from the IV therapy in an appropriate clinical setting to being abused, I don't know the trajectory in terms of that, but I do know in terms of the autopsy report, saying that he died from the clinical effects of ketamine. Well, his serum concentration of ketamine in his bloodstream was in the realm of 3,500 nanograms per millimeter. And to put into context of what we're doing here, when I'm treating somebody with ketamine, the estimated serum concentration that I'm doing is anywhere from as low as 150 nanograms per milliliter to at very maximum 300 nanograms per milliliter. So that's less than a 10% amount that we're giving somebody. I mean, this is
what was Matthew Perry's again?
They're in the realm of 3,000.
Oh my goodness!
And we're dealing with less than 300 is where I'm calculating. I'm not giving anybody over that when I calculate that out. So to put it into perspective, what he was doing at home is much, much different than what we're doing here. And also, I just want to reiterate, at my clinic, I find it extremely important that it's not just me providing the IV ketamine as an ER doctor. I also have a psychiatric, board certified psychiatric professional working alongside me, which I think is a very important part. And I don't know the specifics again of Matthew Perry, but if there were any signs that he was addicted or whatever, and maybe there were signs, I don't know. But if patients are coming to me for their addiction treatment, I really want to make sure that I have also somebody specialized in psychiatry managing these patients as well with me, so that we can make sure we're making an informed decision on how to treat them and that they're safe.
Yeah. Are there any other safety measures that people should be considerate of, or are there resources where they can get insights on how to identify and find someone to, provide this therapy?
So unfortunately, because ketamine is not FDA approved for mood disorders and substance use disorders, it kind of makes it a little bit of the Wild West, I guess you could say, in terms of how
Mhm.
we're using ketamine right now in the medical
Okay.
field. I think there is research out there that shows quite an amazing benefit, but if it's not in the right hands or under the right clinic or however it's managed, it could be dangerous. So I think if you're looking to receive IV ketamine, you should go to a place that is either has a physician or somebody who's trained and knows how to use ketamine specifically for mood disorders. So there's certifications that providers can obtain. And also, I think it's important that they have a psychiatric provider either on site or who works in collaboration with you as the patient. And I think that's very important. Also, I think it's important that whoever is giving you IV ketamine is also well versed in life-threatening emergencies, who also have the appropriate equipment at their office, which just in case there is any sort of emergency, that a professional knows how to use it and has the appropriate safety measures there. And I think as a patient, you have every right to ask that at the clinic and ask that to your potential ketamine provider if you go see them.
Okay, well, I know we touched on it a little bit earlier in the show, but we have a follow-up question from Sarah Oglesby asking about what does a typical treatment look like? And we kind of touched on it, but for those who, came in a little late, let's go back on that. So how does a typical treatment look like? How many sessions? And how often do you need to retreat?
Okay, so so a typical treatment is when the patient comes in for let's say they're coming in for the very first treatment of IV ketamine, we've deemed them appropriate, we've cleared them, they're coming in. So first thing is we place an IV, we place them on a monitor, we check their blood pressure, we make sure their heart rate is okay, their oxygen levels are okay. Based on their weight that day, what medications they're on, I calculate the appropriate dose that they need to get, and I make the infusion here in the clinic, and we start the infusion, hook up to the IV, start the infusion. It's 40 minutes long, and at the peak of the 40 minutes is when it stops, is when you're kind of having your peak feelings. We kind of discussed the dissociation and all the things that you may feel, and then that particular session we repeat at minimum 6 times over a 2 to 3 week period. And the reason for that is because ketamine, it builds up certain metabolites and it creates those kind of long-lasting changes. So you do need kind of this loading dose in a short period of time to create some of those long-lasting changes. Some people do need a maintenance or booster infusion, and that varies from patient to patient. Sometimes it can be 4 to 6 weeks. It could be months, a year, maybe never. Everybody's a little bit different, but sometimes there is a booster needed.
And then what are, you and I, we talked when we were doing our prep for the show, you mentioned some success stories about, people not using whatever the drug was, whatever their addictions were going away. Can you talk a little bit about that?
Yeah. I mean, actually, yeah. I had just a patient the other night say to me and Trish, who's my nurse practitioner, just that without our treatment, that he thinks he may not be here with us anymore. He was so severely depressed, so severely just not doing well. And in combination with our team and his psychiatrist in the community working together, we have just, his life is, I think we saved a life. I mean, so that's just one story. But this treatment works if it's done correctly under the right guidance.
Yeah. So do people who go through the treatments, do they need to make some lifestyle changes, including those who may have marijuana addiction? What are your recommendations there?
Yeah, I think when somebody is currently in the midst of their depression or maybe their addiction, it's difficult to make some of those known wellness life choices that we all know, eating right and exercising right. So our process is let's get you feeling better first. Let's kind of mentally let's figure out how we can get the depression better or your addiction symptoms better. After that, once we get to a place where your mood might be lifted, then let's talk about more wellness things. Let's talk better diet. Make sure you're going to your primary care physician to get your basic blood work done, your annual things done that we all need, exercise. And so it's hard. Sometimes it's hard to make those recommendations when somebody's kind of down or in the midst of something negative, right? So that's sort of part of all of this, that we can make some of these long lasting changes and then here in the clinic and then recommend some of those other amazing things after.
Yeah. So I'm just curious, how does ketamine therapy compare to other forms of addiction treatments?
So what I think is very fascinating about ketamine is we give 6 treatments, right, over this 2 to 3 week period, and then you're not taking it every day. So it's not an everyday medicine, which I think is pretty fascinating. So a lot of people who suffer from addiction or are using pharmacotherapies a lot of times have to take a daily medicine with it, right? So I think what can be very appealing and very interesting is if you're going to come here and receive IV ketamine for your substance use disorder or cannabis use disorder, and you don't want to just replace one medicine with another, it's sort of a way to say, hey, we can give you these treatments, and it's not something that you're going to have to take every day. You're making actual legitimate changes in your brain chemistry, and how it works to sort of live your life a little bit better. So that's what I like about ketamine therapy. I find it very interesting.
Yeah, I'm just curious to know, you mentioned the research earlier. I'm just curious to know if they're looking at using this for other conditions, not necessarily substance abuse or depression, but other things that, other medical conditions. Have you heard anything like that?
I've heard some things, Parkinson's disease, fibromyalgia, some other types of things are being looked at. So they're very, very interesting topics, and hopefully in the future will be discovered.
Yeah, I'm curious to see that too.
Yeah.
So let's talk a little bit about the what's happening here in Florida on the negative side to some degree. So in Florida, we've and we talked about this during our pre-meeting, that there's been an influx of people overdosing on what's called pink cocaine, which is a mix of cocaine and ketamine.
Mm-hmm.
How dangerous is using this drug recreationally?
Well, yeah. So I did look into this, and actually, and maybe if I miss it, but I don't think it actually has cocaine in it. So from what I read, it is a pink substance that has ketamine. It can have caffeine, and it can have MDMA, which is also known as ecstasy. And it's mixed in this like fine powder, and they put like a pink dye in it so it looks pink, but it's termed pink cocaine. And I think the dangerous part about this is it is used as a kind of a designer party drug. It's what it sounds like. And these come across all the year, over the years, there's always a new sort of designer drug, I guess you could say, that's being abused. So this one in particular might be sort of dangerous just because cocaine, we all know it's been used recreationally for years, but if somebody's out there recreationally thinking they're about to do something like cocaine, but instead of cocaine, which the effects are going to be much different if you are about to receive ketamine and MDMA, right? So you're going to switch something that's just maybe it's a stimulant for potentially a psychedelic, and it especially in terms of a female, right? Are you going to be more at risk for you not being aware of what's going on, and it can increase your cardiovascular risk, and so it can be very dangerous, especially if it's under this name of pink cocaine. When you're not getting cocaine, you're getting a psychedelic essentially. So it can be pretty dangerous.
Well, we're seeing an increase in psychedelic use in the state of Florida. Does ketamine have other names that are associated with it that may be more well known on the street versus in a medical setting?
Yeah, I mean, I've Special K. I've seen Cat Valium, Kit Kat.
Cat Valium?
Yeah, because and I don't know the reason why, but I'm imagining because it can be used in the veterinary sense. Maybe I'm honestly not sure. I just can't. I don't know, but those are some names I've come across. But Special K, I think, probably is the most common.
Yeah, and I first heard more about it on some of the more popular shows on Netflix and other streaming shows where they show young people using ketamine, and then of course the tragedy with Matthew Perry. So I think it's becoming a lot more known. And what are you seeing and hearing as far as people talking about it in not only mainstream media but just in general? Are you having more people reach out to you out of curiosity? What are you seeing and hearing?
Well, interesting. I mean, as an ER doctor, interestingly, I probably have seen an increase or rise in people coming into the ER after using ketamine in terms of maybe they use too much of it or whatever. And I would say even in my earlier days in my training, I don't think I ever saw anybody who came in with an acute ketamine ingestion or overdose or anything like that. So there's definitely been quite a bit of a surge, I would say, at least in the ER, where patients are abusing ketamine and having some adverse effects from it.
Mhm.
Yeah, I mean, and there's just more talk, and that's just going to happen. I mean, if ketamine is being used clinically, medically, safely, unfortunately, the drug abuse, unfortunately, is part of sometimes some of these medically useful drugs, and so we just have to educate the public on it and know that there are good treatments, treatment uses for it, but unfortunately, there are negative too.
Yeah. So
Yeah.
aside from your website, which has a wealth of information about ketamine therapy, do you have any other recommendations for where people can get credible information about ketamine and ketamine therapy?
Yeah, there are some associations. There's an association called the Association of Ketamine Providers, essentially,
Mhm.
which is an association which is where you can you have to get cleared, and so you can be a part of and they make sure you're at least in a legitimate clinic. So you can search on that. It's aksp.com. You can kind of search for clinics there,
Mhm.
and you have to be your own advocate. And just, I would recommend finding a clinic that has the safety nets we discussed, but also a psychiatric safety net as well. And not just a clinic that just you go in and you get your ketamine and leave. There's a lot of clinics like that kind of remind you a little bit of this opiate crisis-esque sort of thing, right? We all remember that. And we don't want that. We want a place that people can come that's safe, that's not harming people. So,
Yeah.
and you
Yeah.
can do your own
Well,
research about that too. I mean, as a patient.
yeah. Well, this was very, very informative. I mean, the comments on the social is just like, this is so informative. People are getting a lot of good information here. Do you have any closing thoughts before we wrap up this conversation? Any best practices or information that you'd like to share with our viewers and listeners?
Yes, I just want to just really reiterate that if you think ketamine is a treatment option for you, do your own research in what clinic you're going to go to. I recommend that you go somewhere that has either a board certified physician or at least has that backing and has experience with life-threatening emergencies just in the clinic, who has appropriate monitoring equipment, and also has, which is also equally important, to have a psychiatric provider that also provides you with a psychiatric safety net, because again, you're coming to a place for help, and the last thing we want is for you to leave a ketamine clinic worse, or so that's my recommendation.
All right. Well, Dr. Boyd, thank you so much for being our guest on this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey posted in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on September 5th, 2024, to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. We also encourage you to go to Florida A&M University's Mary website to learn more about this initiative, its educational program, and additional information about cannabis use in Florida. Thanks, everyone.
Thank you.